site as well as remotely working with us on all of the data sets that we have and building on our Center of Excellence. So without further ado, thank you for the time, Dr. Fluke, and
all right.
I look forward to it.
Thank you, Fadia. So the first thing I want to say is that if you have any trouble hearing me, just raise your hand or let me know. Don't feel shy about telling me that you can't hear me, because my voice doesn't necessarily carry very well, and particularly with the air conditioning system, it may not carry very well. So be sure to let me know if you can't hear me. So we're going to talk today about data linkage, but before we do that, I wanted to thank the people who've actually contributed the bulk of the information that I'm going to be presenting in this slide presentation. So these are colleagues that I've known for, in some cases, many years, in some cases just a year or two. But they're from all over the world, as you can see, and they're doing this work for a variety of different reasons that I'll explain as we get into the discussion. I would also say that we have some examples of some types of data linkage that we do at Kemp, but it's of a different magnitude, I think, than what the experience of these particular researchers have been. So just a quick overview of the presentation. We want to talk about why we might think of linked data as a useful thing to have, what's involved in developing a linked data resource, and some examples of what you can do with that sort of data. At Fadia's advice, I've provided some definitions here that hopefully will help ground people in what we're discussing. So there are two terms, administrative data and data linkage. So administrative data are the basic data that are derived from information systems that we use in our day-to-day work. And I've given some examples of some data sets that are used here. So these are data that are used to register potential cases of child maltreatment that come in through the emergency room or through the hospital, through the NFSP registry, the helpline, of course, the scan team, and even the trainee databases could be considered normal databases that you use in the day-to-day operation of a service delivery system or a program to keep track of what you're doing, who's involved, how often, and events that occur, things of that nature. Data linkage, the quote here, bringing together from two or more different sources, in this case by sources we mean databases, that relate to the same individual, family, place, or event. So they share something in common. What's I think also important is that we're talking about linkages at very fine-grained levels. So we're not talking about, you know, creating a rate from an aggregate count, say, of the numbers of children who might be maltreated divided by the number of children in the population. We're talking about actually linking individuals who are maltreated to individuals just in general in the population. And I'll give you an example in a few minutes of exactly that type of linkage. So why would we do this? Because in some cases it's a lot of work to get it organized. But the main reason is that it improves our basic understanding of the risk basis for longer term outcomes. So it tells us in a much more clear way what is underlying, from a causative point of view, some of the things that we experience, like child maltreatment, domestic violence, other types of events like that, and even other types of outcomes, say for a maltreated child with respect to things like their educational attainment, their ability to function in society. So a linked database can tell us a lot of different things that have to do with understanding the lifespan of an individual and all the different systems that have come into contact with that person. So the data from multiple sources has the potential to inform prevention, because we can use it to help understand population level classification of at-risk populations. It can help us make specific decisions about children and families that we're intervening with, and what their risk for certain types of outcomes might be. And it helps with monitoring and evaluation of our service delivery systems, because we can see in a very comprehensive way what some of the outcomes are for our services and whether or not they're effective. And then finally, it's a very cost-effective use of existing data sources. But there are some implementation issues, and this is, I think, what tends to be the biggest concern for those who might be considering this type of system. The first is an ethical issue. Is it appropriate to link data across different data systems? Because in effect, what you're doing is you're tracking people as they come in contact with systems that are sometimes very sensitive. Mental health systems, health records, child maltreatment issues, domestic violence issues. All of these are very, very sensitive issues that could affect people in negative ways if friends or family knew, for example, that these types of things were affecting you. There are a variety of policy and legal issues that can impact whether or not you can actually link data, laws that might prevent it, for example. And then there are also turf issues. Are the people who operate the hospital data systems willing to share their data with the people who operate the social services systems? Obviously, technology and methodological issues are important. We'll talk about some of those. And then finally, capacity and sustainability. First of all, do you have the data sources that might be useful for this sort of purpose? And perhaps equally important, can those data systems be sustained over a long period of time? If you are thinking that you can follow the life course of an individual by understanding their interactions with various systems, obviously you have to be able to maintain those systems, those information systems, for extended periods of time. And so I'm going to talk about some models for some ways that that might be accomplished. So, linked data development. I'm going to talk about examples from California in the United States, from Manitoba, Canada, from New Zealand, and from Western Australia. These are by no means the only places where this type of process takes place, but these are the ones that I'm going to discuss. And then what data are integrated. Again, these are just some examples of the kinds of things that you can potentially integrate. You can integrate child welfare with health billing data, for instance, or with educational data. You can integrate birth and death registry data with labor data in terms of people's employment and things of that nature. So any of these systems are ones that potentially individuals have had some experience with. And the idea then is that any of these can potentially be linked at the individual or event level. So here's an example of how this sort of linkage occurs. So if we start with Child Protective Services data from a social service agency, we're interested in knowing what's happened to individuals before they've had experiences with the Child Protective Service Agency And we're also interested in what's happened after they've had that exposure to the Child Protective Service Agency. And then we're also interested in comparing those to children who've never been in the Child Protective Services system. So, to talk about the linkage process, what we would obtain is a set of records from an information system that deals with child protection. We would also obtain data, birth data from an information system that maintains data on births and also on deaths. And then what we would be able to do is to assemble that on the basis of a birth cohort. We've got the birth data, right? So that's the starting point for a birth cohort. And you can see different examples here. So for child A, for example, we have a situation where that child has been exposed to social services, represented in this case by the diamond, and by the gray circle indicates that they may have died. So we've got the information about their birth, their exposure to Child Protective Services, and a fatality that may or may not be related to social services, but we'll talk about that in a minute. Child B, all we have is a record of their birth. We have no information to indicate that they've been involved in child protection and they're still living. Child C has had exposure to the child welfare system, and child D has died, but has had no exposure to the child welfare system. So the idea then is that by linking records, we can actually describe these kinds of trajectories. So how do we do that? How do we link those data? So the idea here is that you have individuals who are represented in a data file, file A, and another set of individuals who are represented in a data file, file B. And what we're interested in is seeing if those individuals are the same. Pretty straightforward. And we can be really clear about that if we've got something like, in the US, a Social Security number, or here a Saudi ID or something like that. We can be pretty certain that they are the same individuals, and that's called a deterministic match. But in some cases, we don't have the Social Security number. So maybe we've got it in file A, but we don't have it in file B. But we may have other information, like the first name and the middle initial and the last name and the date of birth and the address. And maybe we've got the address in one and a zip code or a postal code in the other. And so in those instances, what we would use is what's called a probabilistic match. And the idea here is that there's a statistical algorithm that's used, and these are available through CDC websites in the US, and yeah.
Sorry, but I think that you mean that all of these variables should match on the other side, because Social Security number, the first name, doesn't make sense that it matches the other side.
Yeah, so what could happen though is that you might, well, so suppose in this file your first name is spelled S-E-R-E-N-A, and suppose in this file, because I entered it, it's spelled S-A-R-E-N-A, so they wouldn't match, right?
They wouldn't.
Right. But on the other hand, you might have the same middle initial in both files and the same last name in both files. And so the idea of a probabilistic match is that not every field has to match exactly, but that most of them match up. So that's really the concept behind the probabilistic match. That's a good clarification. And this is just some example of the types of data fields that you might use for that. So in this case, with the fatality file, these are the fields that might match to the birth records. For the child welfare variables, these would be the things that might match to the birth variables, but might not match to the death variables. So in some cases, we can use a strategy where we match this file to this file, and then once we've got those matches, we can match this file, that set of data to this file, because we have a much better match when we have a lot more information to use than when we just have a limited amount of information. So there are different strategies. And then here's some strategies for actually sorting out whether or not the matches are good. The birth to death linkages that are described here involve a probabilistic match, and then each match has a value that's associated with it. So you pick a point, say a 90% probability, and there might be 10 possible matches. And so those possible matches then are reviewed manually by a research staff to see if in fact they are matching up. And then if you find that there are real discrepancies, you may require some additional review. In this case, for the birth to child welfare linkages, what's done is to look at sort of a gray area concept where we might only review a very small segment of the gray area in order to make sure that in fact cases that may not actually be a match either are or are not. So we're fairly confident about everything from here on as far as whether it matches up, but we're going to look at in more depth a certain set of the cases to make sure that the matches that the probabilistic matching algorithm gives us are in fact accurate. So this is just an example of the data from California. Out of 514,000 births, 4.3 million births, there were 514,000 CPS report records and 25,000 fatality records that were included in this particular data set. And you can see that in some cases, out of the 4.3 million births, some of them had no contact with CPS, no fatalities. Some of them had a contact with CPS and no fatalities. In some cases, no CPS contact but had a fatality, and then CPS contacts and fatalities. So those are the possible outcomes, again, that children might experience. And there are children in the linked data that represent all four of those categories of potential outcomes. So is this making sense as far as how you might go about doing probabilistic matching or matching in general? Any other questions about this? So the example from Western Australia, I think, is really interesting because it describes not necessarily the methodological aspects of this, but how you can do this from the standpoint of establishing an overall infrastructure to help with developing a sustainable resource of linked data. And they've been doing this for a long time. I think this is one of the things that makes Western Australia in particular quite unique. Many of the other places that I'm using as examples haven't really been doing this type of thing for very long, but Western Australia has quite a bit of experience with it. And they have well-developed policies. So these are some of the core data sets in their linked data sets. What's not mentioned here is their child welfare data, but they do have child welfare as another linked set of information. And their objective is to maintain information, as it says here, from cradle to grave. So that's their basic approach to trying to maintain information within the state of Western Australia. And you can see that they're integrating birth records, emergency and hospital records, education records, child protection records, death records, just to mention a few. This is a bit of information about the kinds of things that they're collecting for their child protection data. Again, this would be somewhat similar to the types of data that's collected on the NFSP registry. But when it comes to linkage, they separate that from their clinical and service data. So this is really meant to support a public health function. The data is defined as fulfilling that role. They use probabilistic matching, which I just described. And then they also do an extensive clerical review to make sure that the matches are accurate. And the process works something like this. So say you have two agencies, two service delivery systems, child protection and mental health. The Western Australia maintains a specialized governmental unit called the Data Linkage Unit. So what happens is that these two agencies provide the identifiers that can be used for linkage. So if they've got a number like a Saudi ID, for example, both agencies provide that. If they've got an address, if they've got a date of birth, if they've got a gender, anything that, a name, anything that can be used to identify individuals in the data set. But they don't provide any information about what happened in the child welfare system. They don't provide any information about what sort of mental health issues the individuals might have experienced. All they do is provide the identifiers. So the data linkage unit combines those data and then sends back a single ID to both systems. That's an encrypted ID, so that that ID then corresponds to the individuals in both systems. So you might get a number back, say 1005, and that would refer to individual number 1005, but it would have no relationship to anything else except for the fact that that number corresponds to the same individual in the mental health database and the child protection database. And then that number can be used and provided to a researcher so that the researcher then can have the information from the two systems and link the data using 1005 as the way that they would link the data between the two systems. So these two systems would provide the records from the child protection data and the records from the mental health data to the researcher and that encrypted special identifier that had been provided. So this is just a sense of their organizational structure for setting this up. They have a variety of memorandums of understanding, intellectual property agreements, legislative requirements. So they've got all that sort of organized in one place. They've got an ethics committee that reviews all of the ethical requirements for pulling the data together, a community advisory committee, and in Western Australia, they also have a fairly large Aboriginal population And so members of that community are also sort of provided with special attention in terms of issues that might affect them specifically. And this is the governance structure that gives you some sense of, again, a permanent, established, sustainable approach to being able to work with the data. And this is sort of a sense of their process. They have to approve all of the projects. They emphasize transparency in the approval processes. They review all of the papers and presentations that are organized through this, and they also provide policy-relevant research questions. And this just describes over time the kinds of studies that have been approved by their ethical group. And you can see that over time what they've done is limited the numbers of instances where they're conducting research where a name is identified, and more approving studies where the data are linked through these encrypted identifiers. So in other words, their ethical base is now shifting more and more to the linked databases. So here's some examples of some kinds of things that you can do with the data. This is an example from Western Australia. So we've got information in the lower part of the triangle under the red line there that are from the Child Protection Agency. Information above that from the hospital admissions data, and then information above that from their violent deaths registry. And what you can see from the standpoint of children is the relative overlap. So 66% of the maltreatment-related injuries are known to the Child Protection Agency. On the other hand, out of all of the child protection data, only 3% of those data are also part of the maltreatment-related injury data sets. 19% of the violent deaths are also part of what's known to child protection. So you have some sense of where that overlap is as a result of being able to combine the data across systems. This is a similar example from Manitoba, Canada. And basically it describes the maltreatment-related injuries compared to any injuries, and what's known to the Child Welfare Agency in Manitoba, and what the overlap is. So of the maltreatment-related injuries that are known to the hospital systems, 123 of those are known, but the agency knows of 723 cases where there's also an injury that's known, even though the hospital hasn't necessarily identified a maltreatment-related injury. This is a slightly more sophisticated statistical analysis using the California data. And basically, each one of these bars represents a risk factor for fatalities. So anything below the red line is a protective factor, a factor that would suggest that a fatality is less likely to occur. Anything that's above, and these are expressed as odds ratios, anything that's above would be something that would be a risk factor which might result in a fatality. And you can see the different categories: all injury deaths, unintentional and intentional. And the red bars, these odds ratios here, 2.59, 2.0, and 5.86, are the risks that are due to the fact that those particular children had been reported to child protection agencies. So you can see that in all of these cases, having been reported by into the child protection agency puts you at very, very high risk for a fatality. And certainly for intentional injury, a very, very high risk at an odds ratio of nearly 6. And then this is an example from New Zealand. New Zealand also uses a linked data set. And what they're now in the process of doing is developing what's called a predictive risk model. And this is actually intended to be used for more clinical decision making. And the idea is that if an individual who hasn't necessarily been exposed to the child welfare system before has a certain level of risk associated with other kinds of factors, that may be a reason for the child welfare agency in New Zealand to make a contact with that family as a preventative measure. And so these are just some of the variables that are used. So just to be clear, the benefit type would be a type of social service benefit, like a payment that a family might receive. So that would come out of a general benefit payment database. Care and protection history as a child would be that caregiver's prior experience with the child welfare system. So it might be a mother who had actually been known to child welfare when she was a child. Whether or not they've had any involvement with law enforcement and been convicted of a crime and been incarcerated. Mental health data. So you can see that there are a lot of different types of data that are used in developing this predictive risk model. And one of the advantages, especially compared to prior approaches to risk assessment, is that you end up with fairly high levels of positive predictive value. So in other words, your sensitivity specificity ratios, as indicated by these receiver operator characteristic codes, are quite high. If you're not familiar with these, the idea is that if you think that 40, set a level of about 0.4 for saying, you know, we're going to pick up 40% of the individuals who actually have this particular problem, i.e. likely involvement with child protection, and we're going up to this diagonal, it means that we're also we're going to have a fairly high, what's referred to as a false positive rate. But you can see that the value here, represented by this other curve, suggests that in fact, regardless of our level at which we're going to be detecting things, we're still going to have a relatively low false positive rate. So these values of the ROC curve are actually very, very encouraging from the standpoint of the ability to have much, much greater specificity and sensitivity with respect to the identification of families who are at risk. In the old days, when we were doing risk assessment models with just child welfare data alone, our typical values of the ROC curves were at about that level. So the areas under the curve were maybe at most 0.65. These are in the 0.9 region, so they're much, much better.
So these kids all these models are approached before the fact.
Well, that's
It's predictive.
right.
They're predicting that they might be exposed in the
I am too. And they haven't actually done that yet. So all they've done so far is develop the predictive risk model. So the next phase for them, if they proceed, because there are a lot of ethical concerns about whether you should do this or not, if they proceed, then they'll have to develop those procedures, and I don't think they have a real clear sense of what those should be. We were able to, our group was able to review the research that this represents, and what we recommended was that they may want to consider not targeting individual children and families, but more effectively targeting neighborhoods and looking at more broad spectrum prevention programs that would be potentially beneficial for those families. But that's another thing that the predictive risk model could help with, is identifying specific neighborhoods. So advantages, the ability to do population level classification, as I just mentioned, better predictive risk models, longitudinal lifetime data construction, so you're able to see what's going on with a family through their lifetimes or a child through their lifetimes. There isn't any bias in terms of recall, so that's also an advantage. It is really cost effective because you're relying on existing data that's being collected for other purposes. And it can address sensitive issues like mental health problems and child maltreatment problems. And I think the other key thing is that privacy can be protected, especially when it's set up with a well-established and ethically regulated process. So that's all I wanted to talk about. But if people have questions, that would be terrific. So. Yeah, Serena.
Thanks a lot. It's a wonderful lecture. We always get trapped in the IRB issues and ethical issues. Why is it here with the data linkage? Why they would
allow it?
Again?
Yeah.
Why they have concerns about data that's already there and people are not identified? So what's wrong with linking data?
Well, I think that what we're finding with IRBs is that they're not as concerned about data that's handled in this kind of way. I mean, I think that for the most part, IRBs, are different. First of all, and they exercise their authority in different kinds of ways. But with respect to this issue, at least in the United States, IRB policy is less restrictive when you're using secondary data like this than it would be for original data collection. So, unlike something like the ICAST, for example, where you have this issue of if you're involved in collecting data from children, they may disclose something, for example, that requires you to act. That's not an issue here. You're not having anything of that nature that's occurring. So in some ways it should be more straightforward, but that doesn't necessarily mean that it is. And there are also other reasons why you might have ethical approval issues. Some agencies have guidance either from their from the law or from the policy bodies that govern their performance that they can't share data with anybody regardless. And it's very hard then to have people sort of dial that back a little bit and say, well, what if we could use it in a way that isn't going to necessarily impact people's privacy? And sometimes it's a very, very difficult argument to make when you have an agency that, that doesn't necessarily see the value of doing this type of thing, or has, right. So, yeah.
Thank you, John. The
Mm-hmm.
Whether it's for the victims or for the perpetrators.
Mm-hmm.
In an effort to predict who might be a perpetrator or what are the outcomes of victims. Do you have any experience, or are you aware of systems that do that? They link CPS records to legal or judicial system records?
I know in California that they are in the process of connecting it to juvenile justice records. I don't know if they are yet at the point of linking it to adult correctional records. But in New Zealand, they have made those linkages. So for the caregivers, for example, of children, they are able to link whether those caregivers have had a history of incarceration.
What about so if one is able to identify the profile of perpetrators in their own community
Mm-hmm.
by linking these records, and therefore you're able to predict, in the future, what who might be a perpetrator and using that. I know there are lots of ethical issues with that.
Right, right.
How's that?
Yeah, so I haven't seen an application like that, but in principle it would be, be very similar to this type of thing, where you would be linking. I mean, in effect, what you're doing is, even though this is tied to children, what you're really sort of doing is predicting whether a child in a particular family is likely to be subject to maltreatment. So it wouldn't be that much different to try and link the caregivers, for example, to that from the standpoint of perpetration.
My second question is about the number of IDs. So giving a unique ID to individuals that come from different data sets and giving that ID back to the agencies. Is there a minimum number of IDs? Because you can always decode it and figure out who
Right.
the individual is.
Well, yeah, so one of the things that sometimes happens is that you get restrictions on what you can report as a researcher, for example. So one of the things that is sometimes addressed is the issue of, if you're reporting things in the aggregate, if you have cell sizes of less than 5, for example, that sometimes those data are not reported. So there are, those sorts of masking. And it also depends to a certain extent on the policy of a given agency as to whether or not they're going to place additional restrictions that might prevent some of the decoding kind of approaches that you're discussing or bringing up, I guess. So, but yeah, I mean, I think that it may be the primary sort of ethical issue with respect to these sorts of data. Is can you, in fact, potentially identify somebody based on being able to pull together a lot of information about them? Mm-hmm. Other questions?